Welcome to this recorded session from FMAC's Implementing Group Visits for Integrative Health event. We pick up this recording with our second presentation of the evening by Dr. Michelle Thompson.
Yeah, so just a little bit of background on me. I changed my own diet exercise lifestyle in 1992 when I became a mom. I ran a massage therapy school way back when while I was in medical school. And so that's really what kind of led to my integrative journey. I did my residency at Mercy Hospital in Pittsburgh, and then I did my first really community programming in 2006. I did a community event, Reversing Diabetes with Diet, Exercise, and Lifestyle in person. Trained at Cleveland Clinic with Dr. Esselstyn in the Whole Food Plant-Based program. And then I added a dietitian into my practice in 2016. I really just started doing community programming all in person until COVID. And when COVID occurred, I had been doing 2 to 3 community programs per month and then rolled it all into virtual. Big reason why I rolled it into virtual is because our learners really didn't have anywhere to go to train, and they were getting quarantined left and right. And so it just made it easy for me to be virtual completely and to take whatever learners started coming my way, which was a lot. So we can, and I'm also certified in mind body medicine as well. So my practice really, I'm a virtual primary care physician with a lifestyle medicine emphasis, and I have 3 physicians that are in my building, and we have 3 extenders. 2 are trained by me that are trained in mind, body, lifestyle, integrative, and family medicine. And then we have 1 APP who's more acute care, a nurse practitioner. We have multiple residents from all over our hospital system. So UPMC is about 93,000 employees, and we have many different training programs, and they're all rotating virtually with me every day. I never know who's going to show up into my space. So I take residents from family medicine, internal medicine, physical medicine, and rehab, as well as obesity. And lifestyle medicine really is at the center. I am the medical director of lifestyle medicine for UPMC, and we really put a lifestyle medicine focus at the front and center of everything that we do. So we have these lifestyle medicine and integrative medicine rotations for our medical students as well as our residents, and we're teaching this in the medical school at Pitt. Next slide. So really, this is what our program looks like: 8 family medicine residency programs that are all scattered across the state of Pennsylvania, which if you've looked at the state of Pennsylvania, it's quite large. And so in order for us to be able to accommodate everybody, again, that's why I stay virtual. We have 32 internal medicine residents that actually have lifestyle medicine that's mandated in their curriculum. And then they come and jump in and do integrative medicine with me as well. So we just recently added lifestyle and integrative medicine into our physical medicine and rehab program. And we recently also just added it into our obesity medicine program. And the way this kind of looks is, in our family medicine residency, they get a 2 to 4 week elective. So they'll come and they'll spend Monday with me, that we'll be virtually seeing patients in my traditional family medicine practice. And then we roll into group medical visits at generally 4 p.m. We'll do a mind body skills group. During that mind body skills group, it's 4 to 6 p.m. We'll start with a practice of soft belly breathing. All of our programs, our groups have mind body medicine embedded within them. And then they are participating. They are in a mind body skills group. You are a facilitator, but you are also a participant. So they will check in as well. They will participate in the activities. And then we also have a menopause group that we may roll into after, or a teaching kitchen that we may roll into after. So they are with me quite a long day on Mondays. Tuesday is a little bit less. Tuesday is more 7 to 3, 7 to 4, and we do a noon teaching kitchen. So that's why I was so fascinated by her 3 p.m. time slot. I never tried that. So, but my noon teaching kitchen, which I did as just a trial, a lunch break, was upwards of 25 patients that were attending that because they were logging in on their lunch break. I decided not to cap it, just to see what we were capable of doing. And it was amazing. So during our teaching kitchen, we will do a pantry reset. We will do different recipes from my kitchen to the patient's kitchen, or where the resident's kitchen, wherever we're located. So we'll do the pantry reset, the shop with the doc, label reading. healthy salads, how to make a smoothie, how to make a Nourish bowl, how to make healthy snacks. And that is really for the participant comes once a week for 4 to 5 weeks. It just really depends how many weeks are in the month. And I just set it up for a 1-month program. And so then on Wednesdays, the residents are either with me in person. They will come to my office because I am in a building 1 day a week, or we will use reverse technology. So if you go to the next slide, I think that is one of my, oh, nope, that's not actually, but I'll tell you about the journal club. So we pick our journal club and do it in a teaching kitchen with residents, medical students, and attendings, really taking a good article in Lifestyle or Integrative Medicine and presenting that. And that's been quite successful for us. Next slide, please. Here's one of my residents. So I am in my office, and this is one of my residents that is on a screen who is with us from Harrisburg, and I am an hour north of Pittsburgh. And I also had another resident who was with me in person that day, and we just decided it was so fun that we were all everywhere that we took a photo, and so I decided to put it in this presentation. So really just leveraging technology. There's times that I have multiple residents for multiple different programs that are with me as well. And it's quite exciting. I just allow them to rotate and to, present to me, and then take turns, and, we all just kind of learn. Yeah, they learn together in that environment. So next slide, please. This is a program, I designed a program called Doctors in the Kitchen, Food as Medicine. So we go into teaching kitchens and do in-person with hospitalists. I brought this slide up because I wanted to share with you that the American College of Lifestyle Medicine offers a $250 grant that is for food, and it's open to anybody that is associated with an academic institution or medical school or training program. And so you can get $250 to help towards a food bill. So that's why I wanted to put this in here. Plus, I love working with the hospitalists because I believe that the hospitalists and the residents that are in the hospital, they're really with the patients at the most teachable moment. And so, you're talking to these patients when they just had a heart attack or they just had a stroke, and maybe they're willing to make change and implement some food as medicine. We do offer whole food plant-based consults in our hospital at UPMC as well. Next slide, please. I think the next slide is really just a different teaching kitchen that we were in. This is with the Society of Hospital Medicine and the rheumatological physicians that bring us in and do a teaching kitchen. And again, our students and our residents participate in this. Next slide, please. And if you don't have a teaching kitchen, we built one that goes mobile. And so the way this teaching kitchen works is it is all housed in a suitcase. And you can see on the right that we have some papers lying there. And those papers are an example of the daily dozen, the 12 healthy things we should try to do in our day. And we teach that the patients and or community members, because it's not just patients, implement the daily dozen. They can download the app for free on their phone and just try to eat more beans, nuts, seeds, drink their water, add some spices, move their bodies, etc. And so this mobile teaching kitchen can move every single day. And I will give you an example of where it went later on. But really, and the reason this was built is because I felt like I couldn't be everywhere. And once a week I was in a teaching kitchen live, and I just thought to myself, well, this is easy enough. Our community members can teach the daily dozen because it's very simple. So we would pass it to different spaces. So the teaching kitchen went to the fire department, to the police department, to churches, to schools, to doctors' offices. Anybody that wanted to pop up a teaching kitchen could take the cart and move it. So instead of having only 50 people that it helped in 1 month, it helped 1,000. And we also got grants funded for this as well to get the food. So whoever wanted to do it, maybe it was, church member Sally wanted to do it at her church with her circle of people. She submitted the receipt to me, and we reimbursed her for that. Next slide, please. Just the contents, it costs about $400 to $500 to put all this together, and I just threw it in a suitcase from TJ Maxx, and off we go. Next slide, please. So the way this looks at our hospital is it's very different than Suhani. So I'm excited to share what we are doing. This is all through our integrative medicine is really through our lifestyle medicine department. And we are promoting it to our whole entire hospital system. All specialists prescribe consults or recommend consults, family medicine, gastroenterology, OB-GYN are big referrals to us, cardiology, you name it. I think I've gotten a referral from all different specialties, and they just put in an electronic consult to lifestyle medicine. We are a separate department. The lifestyle medicine assessment, they can get a one-on-one appointment, or we just enter them into a group medical visit. On average, we have about 10 to 15 patients that are in our group medical visit, and we've messed around with a varying number of visits. So I agree wholeheartedly that above 6 weeks, you get a lot of attrition. And there's question with the insurances covering the same thing over and over, week after week. So we're really now at about 4 to 6 weeks. And we do also offer some drop-ins. So the theory behind the mind-body medicine group medical visit, it is generally 8 weeks. So I cut it in half and I did it as 4 weeks. And I first started at 6. Then I decided to switch it to 4. And now we have recurring drop-ins every month. So for all of our graduates, and I wasn't sure how this was going to work because it's just random people coming in and sharing, it's working quite amazing. So people know the model because they've done the 4 weeks of groups and sharing, and then they come drop in the following month to meet each other again, practice their skills, learn a new skill, and really just have a place. It really helps patients with social isolation, loneliness, just giving them a place to go. And we also offer through our department dietitian services for medical nutrition therapy. So our residents come in on Mondays, as I said, is with me. On Tuesdays is with another physician who is lifestyle medicine boarded, as well as family medicine. On Wednesdays, the resident works with and our students work with our dietitian as well as my physician assistant. And on Thursdays, they are working with another lifestyle medicine physician who is also family medicine. So they have the opportunity to do group medical visits 4+ days a week, because on some days we have multiple groups running during that week. Next slide, please. Okay, so yeah, it comes in through an e-consult through Epic. It's also something I wanted to share is that we have handouts built into Epic for the all the patient handouts at the click of a button. So we are members of the American College of Lifestyle Medicine and have lifestyle medicine residency curriculum in our 8 family medicine residencies: internal medicine, physical medicine, and rehab. And so all of these patient handouts are at the click of a button, and we can put them into the after visit patient instructions. Again, we're all virtual. I miss in person, Suhani, so I was a little bit like, oh, my heart being with the people. But I will show you, we have done some hybrid blends. And so when we do these e-consults, we determine where the person would fit best. And if we can't really figure it out, maybe they're too complex, we'll do a one-on-one with them. And then we'll determine if we can send them to any other resources that we have at UPMC. We have a integrative medicine center that offers acupuncture, chiropractic. We also have in-person mind-body groups if they are in the city of Pittsburgh. We have pelvic floor physical therapy, fascia, naturopathic that they can participate in as well. And we are adding a health coach soon. So just to let you know about that. Next slide, please. So our group medical visits that we're currently offering, we have one in sleep and stress, and it's in a 4-week format as well as in a drop-in format. We have nutrition as food as medicine, as well as teaching kitchens. As I showed you, we have our mobile cart as well as in person, as well as virtual. And then culinary medicine. So once they graduate from one of our food as medicine programs, by the way, we designed our initial group medical visit is designed after UC Davis SLIM, which is Sustainable Lifestyle and Integrative Medicine, I think, weight management program. And it is by Deepa Sanidhi is my colleague, I share this with you because her program is completely free and downloadable. So if you said tomorrow I want to start group medical visits, you can go to the SLIM UC San Diego's website and get the curriculum, and you can start it. It is a 12-week curriculum. She is family medicine, obesity medicine, integrative medicine, and lifestyle medicine. So she's, really her food as medicine program that she designed is very much about body positivity, healthy at every size, integrative approaches to nutrition. So I loved her program. With attrition, I felt like it was too difficult doing the 12-week program. So we cut it into a 4 to 6 week program. And then we have monthly culinary medicine drop-ins, just like we do with mind body medicine, that they can come into. And then our mind body skills groups, I already discussed a little bit about that. We have the 4-week group covers soft belly breathing, expressive meditation, shaking and dancing, autogenics, biofeedback, wise guide imagery. We'll do dialoguing with a symptom, as well as compassion, forgiveness meditation. Next slide, please. And then specific groups, I just launched a menopause group medical visit, which has been so exciting. I am a woman in menopause. So I decided to make a group in menopause. And like Suhani was saying, we get to be creative and we get to do whatever we want, right? So it has been very joyful for me to sit with these women and help them to understand what's going on in their bodies. And it's been fun for the residents to participate and the medical students to participate in this, and really to learn that this is very helpful. So next up is PCOS. That's starting, as well as men's health. So the one-time group medical visits that we're offering are for diabetes, hypertension, gut health, sleep, and medicine. I want to go back for just a second. So I was doing these groups on weight management, as Suhani was saying, but then I was having difficulty sending it out to all of our patients on Epic, because I was identifying that it would be good for our hypertensive patients, good for our diabetic patients. And when I was sending it out to this population and they weren't overweight and it was called weight management, they called me out on it. And I was like, oh yeah, it's not necessarily really about weight, it's more about metabolic. So I changed the name to food as medicine. So what used to be weight management is now food as medicine, just to make sure that, patients all feel like they can show up. And I do tell them, it is really about weight, but not about weight, so it's very hard to find that line, because like she said, everybody wants weight. I think that's the one that was highest. I would love to see that slide again. But yeah, so I just wanted to share that too. Next slide. We have a movement pillar. We have a substance pillar coming soon, and we're always planning new groups. My next thought is to do one preoperatively for orthopedic surgery, because there's a lot of need in that space. And so that's something that we're going to be offering soon in partnership with our orthopedics. And so this is our virtual blend. So this is our group in person. So we've got 3 of our team that are in person with a community of people. This is at a UPMC neighborhood center. And we also have on the screen me and my project manager, Dr. Melissa Kerr, as well as other patients from a group medical visit that was a teaching kitchen. In that group medical visit, the teaching kitchen, we got a grant from One Avocado, and that grant gave us $500. So we took our group of patients and we did our traditional 5-week group. In the 5th week, we had Instacart send food out to their house so they could cook along with us while we were live in this site. And so it was a great success. The people that, and we also opened it up to our lifestyle medicine interest group, which is also integrative, students. Everybody is kind of like integrative lifestyle in our space. And so the people that all logged in, nobody knew who was a patient and who wasn't for HIPAA compliance. We had it all a separate link through Teams, but it was great. They were really excited to get free food delivered to their house. And these people that were in this space, this is a food pantry delivery site. So we picked a recipe that they could learn to do with their food pantry items that they get. We did a Nourish Bowl with them, and it was really fun for me to be virtual. I live an hour from this site, so I was able to this is one of my exciting things I wanted to do. Next up is leveraging technology to use interpreter for Spanish group, because there's a need for that they can't speak English. So we're going to try it. Next slide. I think the next slide really is just our group of all the people that were live in person that were so happy to be there, and I was happy to be with them. Next slide, please. We have a Shop with a Doc video that's on my website. So if you just do Shop with a Doc, Dr. Michelle Thompson, it is like 30 minutes of me and Aldi, I think, with my dietitian. And we just go over food label reading, and we use this. My residents use this to give to their patients. The medical students use this. And we just use this in our group medical visit to say, because we can't go shopping with everybody. I used to literally go physically shopping a lot. And then I just was like, okay, we should record this. Like, I don't have time. And it's great. I just had a patient say how helpful it was. Eating healthy on a budget is one of the handouts that we offer, and it really helps around that. Like, how can they get more beans, nuts, seeds? How can they freeze their produce that may be starting to go bad? How can they make their own vegetable broth, etc.? Next slide. This is our team. So we have our strawberry on the left is Dr. Melissa Kirsch. She's an integrative physical therapist, a yoga therapist, as well as our lifestyle medicine project manager, and myself and my physician assistants who are integrative lifestyle, mind body medicine. And then the remainder of our team at the bottom who are lifestyle medicine physicians as well as faculty, and our dietitian is on the beach. Our dietitian lives in California, by the way, so we don't have an in-person dietitian. So we use some of the dietitian students and dietitians who want to volunteer through PIT. Next slide. This is one of our students presenting at the American College of Lifestyle Medicine. And so UPMC's presence at the American College of Lifestyle Medicine was quite big, actually. So that's why I took a photo of that. And I just think it's a great way to, get our medical students and residents involved by doing poster presentations. So I wanted to share that. We have a lifestyle medicine interest group, and this is how we keep everybody together, because lifestyle medicine really is the core, I think, of integrative medicine, reviewing the pillars of sleep, exercise, nutrition, stress management, and substance use. So this is just the slide that I usually give people to sign up for that. And then we also, next slide, please, we have an Instagram page that we try to keep everybody connected with. Next slide, please. And so really, we have a Wellness Wednesday in our hospital where we have mostly plant forward. We have plant strong meals that patients can get, and residents and medical students can be spokespeople for this and share that with their patients and colleagues. They have the opportunity to spend a day with a dietitian, to jump in and join any of these groups. We encourage them to go to ACLM in Orlando, and then the Academic Congress of Integrative Medicine and Health, which was just last week in Cleveland. And I think that's it. Next slide. I just wanted to share this. I actually was in the New York Times for the work that I did in mind body medicine throughout our hospital system. So we offer mind body skills groups for our medical students, as well as our residents, nurses, as well as physicians, really just to teach the skills. And so I wanted to share this book with you, because this book, Transforming Trauma, The Path to Hope and Healing, is the core of mind body medicine. And it really does teach the group medical visit model, which is at the base of everything we do for our group medical visits. Next slide, please. I also wanted to share that this is a free, American College of Lifestyle Medicine has a food as medicine course and a lifestyle medicine course that is free. And so we share this with all of our employees, our medical students, our residents, anybody, nurses, occupational therapists, pharmacists, are really learning food as medicine throughout this course. And it's all free for anybody in the United States. Next slide. And here's my information. So I think I covered everything, and I'm happy to answer any questions. I will share billing is generally a 99213. We use a 33 modifier to try to get rid of the copay. We've identified some problems with that 33 modifier. Blue Cross Blue Shield doesn't want it to be virtual. And so I have a meeting with Blue Cross Blue Shield on Friday to figure out why, because if we take off the modifier, it gets covered, because it's considered, the 33 modifier is considered a preventative visit. But I was just trying to do the best I could, because this is preventative really for our patients. If we have social determinants of health, we can bill a 99214. I do offer a one-on-one. I don't pull out specifically. I used to in the beginning, like Suhani was talking about. but it became too difficult to pull everybody out. We don't have breakout rooms. We utilize video, which is in Epic. It's embedded directly in their chart. And so they told me as long as I offer a one-on-one. So I put that in the chat, and I just say, you're welcome to a one-on-one. I also have a confidentiality statement that they keep everything. What happens in the group stays in the group. I keep that. I put that every week. What else? Anything I didn't? Our groups run from 1 hour to 1.5 hours to 2 hours, depending on the group. I do think 2 hours is quite long for people, but that's the model of the Mind Body Medicine, and I haven't figured out how to shorten it, because the check-in truly does take an hour. And I will tell you, as the lead physician overseeing all of this, I stay in the group for the first hour, and then I move into the next group. And so right now, that's what I'm doing. That way I can build the groups, and I'll leave somebody that's trained in the group. The resident oftentimes moves with me into the next group. I usually leave it up to the resident to decide if they really want the mind body skill, they stay. If they want to move with me into menopause or a teaching kitchen, it's really, I allow them to kind of gauge what they feel like they want to learn.
Thank you, Michelle. That was
A lot.
great.